Title: Natural Remedies for Male Sexual Health, Combating Erectile Dysfunction, Penile Curvature, and Premature Ejaculation. In today's fast-paced world, many men face challenges with their sexual health, including issues like erectile dysfunction, penile curvature, and premature ejaculation. While these conditions can be embarrassing and frustrating, there are several natural remedies and lifestyle changes that can help improve male sexual health without the need for prescription medication. In this blog post, we'll explore some effective home remedies for addressing these common concerns. Understanding male sexual health issues *. Before delving into remedies, it's important to understand the underlying causes of these conditions. Erectile dysfunction, ED, can be caused by a variety of factors, including stress, anxiety, depression, hormonal imbalances, and underlying health conditions like diabetes or cardiovascular disease. Penile curvature, also known as Peyronie's disease, is characterized by a significant bend in the penis during erection, often causing pain or discomfort. Premature ejaculation, PE, involves the inability to control ejaculation, leading to climaxing sooner than desired. Natural remedies for male sexual health *. 1. Healthy diet and lifestyle changes *. A well-balanced diet rich in fruits, vegetables, lean proteins, and whole grains can improve overall health and sexual function. Regular exercise can help improve blood flow to the genitals, promoting better erectile function. Avoiding smoking, excessive alcohol consumption, and recreational drug use can also benefit sexual health. 2. Herbal supplements *. Certain herbs have been traditionally used to improve male sexual health. Examples include Panax ginseng, known for its aphrodisiac properties. Ginseng may help improve erectile function and sexual stamina. Horny goat weed, this herb has been used in traditional Chinese medicine to treat ED and boost libido. Tribulus terrestris, believed to enhance testosterone levels and improve sexual performance. Ginkgo biloba, improves blood circulation, potentially aiding in erectile function. 3. Acupuncture *. Acupuncture, an ancient Chinese practice involving the insertion of thin needles into specific points on the body, has been shown to improve erectile function in some men. 4. Kegel exercises *. Kegel exercises aren't just for women, they can also benefit men by strengthening the pelvic floor muscles, which can lead to better control over ejaculation and improved erectile function. 5. Yoga and meditation *. Stress and anxiety can contribute to sexual health issues. Practices like yoga and meditation can help reduce stress levels and promote relaxation, potentially improving sexual function. 6. Aromatherapy *. Certain essential oils, such as lavender, rose, and sandalwood, may have aphrodisiac properties and can be used in aromatherapy to enhance mood and promote relaxation. 7. Healthy sleep habits *. Getting enough quality sleep is essential for overall health, including sexual health. Aim for 7 to 9 hours of sleep per night to support optimal sexual function. 8. Communication and relationship building *. Open communication with your partner about sexual concerns can help reduce anxiety and improve intimacy. Building a strong emotional connection can also enhance sexual satisfaction. Conclusion *. While male sexual health issues like erectile dysfunction, penile curvature, and premature ejaculation can be challenging, there are many natural remedies and lifestyle changes that can help improve these conditions. By adopting a healthy diet and lifestyle, incorporating herbal supplements and alternative therapies, and addressing underlying emotional factors, men can take proactive steps to enhance their sexual health and overall well-being. It's important to consult with a healthcare professional before starting any new treatment regimen, especially if you have underlying health conditions or are taking medications. With patience and persistence, many men can experience improvements in their sexual function and enjoy fulfilling intimate relationships. 11 Natural and home remedies for erectile dysfunction. Some people may use natural treatments, home remedies, or lifestyle changes to treat erectile dysfunction, ED. These include ginkgo biloba, ginseng, acupuncture, and yoga. However, medical treatments may be necessary to address an underlying cause. Erectile dysfunction, ED, is a common condition that refers to a recurrent inability to get or maintain an erection of sufficient rigidity and duration for sexual intercourse. ED can be due to trusted source physical or psychological factors, such as problems with blood flow or anxiety over sexual performance. It is not uncommon to experience problems with erections occasionally. However, if it happens routinely and disrupts a person's life, they can try various treatments. This article discusses the various ED treatment options, including natural remedies, alternative medicine, and prescription drugs. It also explores their risks. How to treat erectile dysfunction. ED happens when trusted source blood flow to the penis is limited. Determining its cause can help people find the most appropriate treatments. In some cases, ED has a physical cause, such as a treatable health condition or circulation problem. Treating any underlying conditions will help. People can take steps to boost their circulation, such as doing regular exercise, quitting smoking if applicable, and making dietary changes. A doctor may also recommend prescription ED drugs, such as sildenafil, Viagra. ED can also happen due to stress, relationship factors, or emotional factors, such as anxiety, depression, or trauma. Mental health treatments and relationship counseling can help. Some people also try natural or alternative treatments, including over-the-counter, OTC, pills, herbal remedies, and acupuncture. It is important to understand the possible risks associated with ED treatments, especially natural remedies, which the Food and Drug Administration, FDA, has not approved. A person should speak with a doctor about treating ED. Read more about pills for ED here. Natural remedies. While many natural remedies for ED are available in stores and online, none have received FDA approval. The FDA does not recommend using OTC products for ED because no authority's trusted source regulate them for safety or effectiveness. These products often contain undisclosed ingredients, inappropriate doses of prescription drugs, or different doses of ingredients than the label suggests. The Urology Care Foundation agrees, saying that although supplements are popular and often cheaper than prescription drugs, they are not guaranteed to be safe or effective. There are very few studies on the safety of natural remedies for ED. Some remedies have side effects varying from mild to severe. Furthermore, an older study trusted source investigating 4 popular herbal substances used for ED found that uncontrolled availability of potentially harmful substances was a cause for public health concern. The researchers concluded that extensive study and monitoring are necessary. The following list looks at some common natural remedies that people use for ED. L-arginine. L-arginine is an amino acid, which is a building block of protein. It is a vasodilator, meaning that it can help open up the blood vessels. In theory, this could increase blood flow to the penis and help produce an erection. A study from 2017 trusted source reported that many people with ED had low L-arginine levels, which suggests the two may be linked. However, scientific studies have not proven that taking L-arginine supplements can treat ED. More research is necessary before researchers know the safety and effectiveness of this remedy. Side effects of L-arginine may include nausea, stomach cramps, low blood pressure, and increased blood sugar levels. Propionyl L-carnitine. An older 2004 study trusted source on men with ED and diabetes found that taking propionyl L-carnitine alongside sildenafil could improve erectile function better than taking sildenafil alone. That said, more studies are needed before researchers know the actual safety and effectiveness of this treatment. Side effects are usually mild and can include a skin rash, nausea, diarrhea, and heartburn. This substance may not be safe for people with vascular disease, high blood pressure, diabetes, or liver cirrhosis, among other conditions. Dehydroepiandrosterone. Dehydroepiandrosterone, DHEA, helps create sex hormones, including testosterone and estrogen. Natural DHEA levels decrease as a person gets older, which may cause a decrease in sexual function. While some studies trusted source suggest that DHEA supplements could help with ED, while others trusted source have found no evidence of their benefit. DHEA generally causes few side effects when people take it orally in recommended doses. Possible side effects can include fatigue, headaches, acne, and an ginseng. Ginseng, or Panax ginseng, is a popular home remedy. Certain chemicals in this plant may promote the relaxation of the body's smooth muscles, helping produce an erection. A 2012 study trusted source suggested that ginseng berry extract could help treat mild to moderate ED, though more high-quality research is necessary to confirm this. However, a more recent study trusted source concluded that ginseng might only have trivial effects on erectile function. The most common trusted source side effect of ginseng is insomnia. Other side effects include increased heart rate, high or low blood pressure, and headaches. Read more about ginseng and ED here. Yohimbine. Yohimbine, the main component of an African tree's bark, is a traditional aphrodisiac. The NCCIH trusted source report that there is not enough evidence that yohimbine from tree bark can treat ED. Yohimbine hydrochloride, a different form of yohimbine, is available as a prescription drug for ED. This is a different product than dietary supplements made from tree bark. Studies have linked yohimbine with serious side effects, such as heart attack and seizures. Other side effects include stomach problems, anxiety, and high blood pressure. Horny goat weed. Epimedium grandiflorum, also known as horny goat weed, is a traditional remedy for increasing fertility. A 2010 study trusted source found that the active component of horny goat weed, icariin, may have positive effects if treating ED caused by nerve injury. However, researchers conducted this study on lab-grown nerve cells and rats with injured nerves. This supplement is often well tolerated, but there is not enough evidence to support its use. Side effects can include trusted source nausea and abdominal discomfort. Lifestyle changes. Certain activities or a lack of activity can affect ED. People who have not already adopted the following lifestyle or self-care measures may find that they improve the symptoms. Trusted source of ED. Regular exercise. Exercise can benefit ED by improving blood pressure, blood flow, mood, and stamina. It is also an effective method for improving overall health. Read about the best exercises for ED here. A healthy diet. A healthy diet helps keep the circulatory system and the rest of the body healthy. Eating a varied, nutrient-rich diet reduces the risk of heart disease, clogged arteries, obesity, and diabetes, which are risk factors for ED. Read about foods for ED here. Reduce smoking and alcohol intake. Smoking is a major risk factor for ED as it reduces blood flow to the penis. Drinking excess alcohol can also have an effect. The Centers for Disease Control and Prevention, CDC, trusted source. Trusted source. Centers for Disease Control and Prevention, CDC. Governmental authority, go to source. Recommend that males limit alcohol intake to 2 drinks per day and females limit theirs to 1 per day. Reduce stress. Stress and anxiety can have a significant effect on sexual desire and erectile function. Common sources of stress include health, work, finances, and relationships. Read about stress relief products and natural ways to combat stress here. Alternative therapies. Some people try alternative therapies, such as acupuncture and yoga, for ED. There are few studies available to support their effectiveness for the condition. However, they may help reduce stress, which could improve ED. People may also benefit from the placebo effect. A 2009 study trusted source found that taking an oral placebo pill improved ED symptoms as much as taking an ED drug. Prescription drugs. Prescription medications can increase blood flow to the penis. The 4 main FDA-approved drugs for ED trusted source are sildenafil, Viagra; Avanafil, Stendra; Tadalafil, Cialis; Vardenafil, Levitra. These drugs, known as PDE5 inhibitors, relax the muscles in the penis to enhance blood flow. Side effects of prescription ED drugs can include trusted source: headaches, nasal congestion, indigestion. Prescription ED drugs are not safe for everybody, including people with very low blood pressure, uncontrolled high blood pressure, or liver or kidney disease. People who are taking nitrate-containing medications should also avoid these drugs. Talking therapies. A person's psychology or emotional health can have a significant effect on sexual functioning, including ED. This includes mental health conditions, such as depression or anxiety. Negative experiences in the past can also affect a person's current sexual functioning. Speaking with a mental health professional, such as a counselor or psychologist, can often help trusted source people overcome stresses and anxieties linked with sex, relationships, and other areas of life. ED devices. Various physical devices can also help trusted source people get and maintain an erection. For instance, vacuum devices are mechanical pumps that create an erection by drawing blood into the penis. Alternatively, people can try ED rings, which are bands that a person places around the base of their penis to maintain an erection. When to contact a doctor. A person should speak with a healthcare professional if they are experiencing ED on a regular basis. If they would rather not speak with a doctor, people may wish to try home remedies, such as regular exercise, reducing alcohol intake, and avoiding smoking. They may also prefer to speak to a mental health professional and try talk therapy for ED. It is important to note that ED medication and natural remedies for ED can cause serious side effects. There is also a risk of interaction with existing medications. Therefore, a person should always speak with a doctor before consuming anything to treat ED. Frequently asked questions. Below are some of the most common questions and answers about ED. What is naturally good for erectile dysfunction? There is some evidence to suggest the following natural remedies may be good for erectile dysfunction. L-arginine, ginkgo, yohimbine, regular exercise, a healthy diet, reducing smoking and alcohol intake, reducing stress. What herb is equal to Viagra? Ginkgo biloba, ginseng, yohimbine, and horny goat weed are herbs that may have similar effects to Viagra. What is the fastest way to cure erectile dysfunction? Almost all cases of erectile dysfunction are treatable. A fast way to treat erectile dysfunction is by using a vacuum device or erectile dysfunction ring, or taking prescription medications that increase blood flow to the penis. These include sildenafil, Viagra, avanafil, Stendra, tadalafil, Cialis, vardenafil, Levitra. There are many possible ways to treat the symptoms of ED, and the best options depend on the underlying cause. Where possible, a person should talk to a healthcare professional before taking any new supplements or OTC medications, as they can have side effects and interact with existing medications. The FDA does not approve OTC ED medications, which may be dangerous. A person should consider using prescribed treatments for ED or speaking with a doctor about alternative options. There are many possible ways to treat the symptoms of ED, and the best options depend on the underlying cause. Where possible, a person should talk to a healthcare professional before taking any new supplements or OTC medications, as they can have side effects and interact with existing medications. The FDA does not approve OTC ED medications, which may be dangerous. A person should consider using prescribed treatments for ED or speaking with a doctor about alternative options. Summary. There are many possible ways to treat the symptoms of ED, and the best options depend on the underlying cause. Where possible, a person should talk to a healthcare professional before taking any new supplements or OTC medications, as they can have side effects and interact with existing medications. The FDA does not approve OTC ED medications, which may be dangerous. A person should consider using prescribed treatments for ED or speaking with a doctor about alternative options.